Preservé technique really is a unique approach to breast enhancement. And the thing that's really different about it is that it uses different principles of surgery, but does not involve dissecting as much and cutting as much. So when we are forming an enhancement of the breast, we're actually separating the tissues and not cutting any tissues. It's also unique in where we're putting the device. The device is not being put under the muscle. The device is not being put under the fascia. It's actually being placed above that. It's being placed in this plane called the posterior lamella. Interesting thing is that after that's placed, the implant and the breast kind of behave as one, so they move together. Whereas in traditional techniques, the breast will move separate from the implant. The other thing about Preservé is you're also using a smaller device and getting a bigger fill, because by being in this unique pocket, you actually get more expansion of the breast soft tissue envelope, so you can use a smaller volume to get a bigger effect. Now, the device, the way that it works is that because of the technique, we can do this device under even local anesthesia. Literally, you don't have to be put to sleep to have this procedure done. What'll happen is a patient comes in, we review all the plan, talk about size, but in the operative day, they'll come in, they'll go to the operating room, and depending on if they're getting anesthesia or not, they either will get a little anesthesia and then we'll begin, or they'll be awake and we'll numb the incision line. So in both situations, we'll numb the incision line with local anesthesia. Once that's done, we'll literally make a little tiny entry point incision, and then we will numb the breast. When we are numbing the breast, we use something called tumescent anesthesia. Tumescent anesthesia is just dilute numbing solution that we typically use even for liposuctioning. After we perform that tumescent anesthesia of the breast, we wait about 10 minutes. That's doing two things. It's making sure that everything is nice and numb, and then it's also allowing the breast tissues that we've injected, adrenaline is in there, so it makes sure that it doesn't bleed. After that's done, we then make our incision. That's the only time we cut. So we make a small incision. It's literally about this big, max 3 centimeters. We make it large enough to use this device. This is a channel introducer made by the company Preservé, aka Motiva. And what we do is we use this, and this device has a blunt tip, but it has a little bit of a dissecting tip to it, and we create a channel. We're holding the breast up, and then we're inserting this. And so this is riding right above the fascia of the breast, not injuring the fascia, not injuring the muscle. And after that's done, then we take this device here, which is a balloon dissector. So we coil this up, insert this into that channel that we just made, and then we expand it. And that's what actually expands and creates the pocket under the breast. We remove that, and then we insert the implant in with a Keller funnel. So we still use the Keller funnel for this procedure. One of the other important tenets of this procedure is that we use a lot of ultrasound. The ultrasound is used to confirm that we're in the right place when we're numbing the breast and also when we're placing the device into the breast. It actually takes a very short amount of time to do this procedure. So typically getting ready for surgery, bringing the patient back, prepping the patient, numbing the patient. The procedure itself is quite quick, and I think that's a unique thing. Why it's different is really this, is that number one, we don't cut tissues. We're really not traumatizing, we're just separating tissues. So I think we're causing less damage. We're using smaller implant. The other is that it's very little to almost no pain afterwards. It's really remarkable, and I think you really can tell this when you do several of these as a surgeon and you hear what your patients have to say, and then also hear what they're doing the night of the procedure or the next day. And I think that's really important so that they can actually get back to activities. They can avoid basically any pain medicine. If they have fear about anesthesia, general anesthesia, they don't have to have that. So I think this is a unique thing for breast enhancement. I think it's a game changer. I think it's going to be a way for a lot of women who wanted to maybe just fill out their bra, didn't really want to be big. Now they can have this procedure done and literally get it and move on with their lives. This is a really special thing for patients who want that kind of refined, small volume enhancement of their breasts. When people have Preservé performed, the scars are typically a lot smaller than a traditional breast enhancement. So typically it's going to be about 2.5 to 3 centimeters in length. That's about this long, and it's right in the breast fold. Long term, it should hopefully not be very visible at all. Typically, they fade over a period of about a year. This technique of Preservé has been in the works for many years now, and matter of fact, myself and my business partner, Bill Cortezes, we actually have been working closely with Establishment Labs Motiva for many years now, and actually we visited approximately 5-6 years ago to their headquarters in Costa Rica and actually performed a unique procedure called MIA, where we actually use a similar technique that's automated one, where you actually use a pressurized device to help insert the implant through a atraumatic dissection like they do with Preservé. Eventually that will be coming to the United States once we get FDA approval. So this is something that we've had our eyes on for a long time now. We're very excited to have it and bring it to our patients. And at the end of the day, this is a technique. This is part of our repertoire of how we approach patients to get them the best possible result. It doesn't replace everything, but it's a new technique that is innovative. That is a great technique for a specific section of our patients. Will definitely be here to stay. One of the things about Preservé that's unique though, is that's really landmark, is the recovery. The recovery recovery is truly way simpler than even a traditional augmentation. Now, I have to say that a traditional augmentation, typically the recovery wasn't too bad. Like if you did things appropriately, you can drive the next day, you can move around, do normal activities of daily living, but maybe not high intensity stuff for at least several weeks. With Preservé, the thing that's really different is that you really don't have any discomfort. You have the ability to kind of use your arms even more freely. There's not really any pain afterwards. The recovery cycle is condensed even further. It's just less invasive, less of an intervention. You're literally causing less disruption. You're doing things in a more atraumatic fashion. So the intensity of that recovery is really reduced. And the ability to do it under a minimal to essentially no actual anesthesia other than local anesthesia is very different than other techniques. This technique, Preservé, is really great for patients who want to have a small volume enhancement. Sizes that could be done with this are as low as the low 100 cc's up to the mid 300 cc's. Now that's different for everybody. I would say that for someone who's wanting to have a breast enhancement who doesn't have a lot of other issues going on, like big asymmetries or chest wall deformities, and or that have had multiple other procedures in the past, this is usually for someone who hasn't had breast enhancement done in the past. So someone who hasn't had one would be a good candidate, who are wanting to have a breast lift as well, so they are not, separate entities. They can be combined and done together. That it's really done for the patient who wants to try to have minimal recovery, who get maximal fill with the smallest volume, who wants to avoid disruption of the muscle and disruption of the fascia. Preservé typically is used for primary breast enhancements. It actually could potentially be used for a secondary or revisionary work, but the way that it is actually used and was initially brought to market was to be for primary. At the end of the day, though, I will tell you that there are unique cases, unique situations where we will likely use this in secondary or revisionary cases, or someone maybe who had a breast enhancement in the past, got them out, now wants to have them put back in. There are going to be situations where we can use this technique, and this is again part of our toolbox that we can use to get the best aesthetic goal for patients for their breasts.